COVID is killing many young children in Brazil. To the tune of over 2,000 kids have already died in Brazil, and pregnant women have given birth to stillborns. There's also news of a COVID variant in Singapore that is infecting children. And hence there's an alarm in India about protecting our children from the third wave to come. Will the third wave impact our kids more? Take a look at my report. COVID kills over 2,000 children in Brazil. Mothers give birth to stillborns. And hence today, the worry increases on whether India can run into the same fate given the cavalier response of the government. The focus now is to protect Indian kids.
The lack of health infrastructure will actually sicken more people. And that's inherently the greatest, saddest thing, because those things are preventable with public health measures. And so I really pray that India gets its healthcare infrastructure improved.
An abundance of population is a matter of concern for India that could see a third wave. But will it be worse and impact kids more? Experts say there is no evidence as yet.
I think out of an abundance of caution, we should potentially plan for a third wave. And in terms of whether it would be even worse among children, I've seen no evidence to suggest that the current wave is any more severe in children. When we have so many cases of confirmed COVID disease in the population overall, naturally, we're going to see a tremendous number in children as well.
A concerned mother and also a doctor who wants to vaccinate her child has questions on vaccination repercussions on kids.
You know, what I worry about is, okay, what would the next wave be? What's the next variant? But then I also worry about what are the risks of the vaccine. So if right now the kids, the mortality rate is extremely low, then if I'm giving my child a vaccine and the vaccine has a higher mortality rate than COVID itself, then I'd want to understand that. I'd want to know.
We have these trials, and this is why children are getting the vaccines later than adults. And in terms of the actual consequence, there's no proven clotting in children. There's no assumed risk. But we know there's a huge known benefit, right? The huge, large benefit. And there's no apparent risk in children whatsoever.
India has lessons to learn from the deadly kids wave in Brazil and pick cue from the catastrophe and be prepared regardless. In conclusion, epidemiologists are of the strong opinion that a third wave is likely in India, with not much evidence to prove that it's going to be worse in kids, but there would be no excuses for India to not prepare. A proactive, precautionary stance is what India needs to adopt. In New Delhi, Shaiti Narula for India Today.